Sorry, I assumed Lindsay was the chair last time I was here.
You are correct.
Okay. So if you're ready, Lindsay, Lynn is ready to start.
Thanks, Brenda. Welcome, Lynn.
So Lynn had put a note in Q&A that she's also participating in PRAB. So she may actually have stepped away from this meeting temporarily. Are you there, Lynn?
I see Lynn's hand.
And I see you're unmuted, Lynn, but we can't hear you. And we hear a little bit of you, but not your voice. Lynn, we're going to come back to you.
Lynn, regresamos contigo. Ahora vamos a William Sweeney y luego regresamos contigo, ¿ok?
Sorry, all my buttons
I'm unmuted.
There you are.
No,
There
this
you
is
are.
Lynn.
Okay. So William, we'll come back to you after Lynn, now that we can hear Lynn. And Lynn, go ahead.
Okay. Yeah, I was at PRAB also, because they're at the same time. And the testimony is, and I had to juggle back and forth. And I listened to both of them, but I have to turn off the sound of PRAB because they're on two different formats, like webinar and not webinar or something. Because usually it takes over all the bandwidth, you know. But I don't have two audios. I can't turn their audio down and listen to you now. But anyway, my concern is human resources, Human Relations Council needs to be concerned. I know you're involved with inclusionary things and, you know, the poor and the minorities and all of that. But you know what? Your board is like opening the door in the middle of a 0-degree winter and turning up the heat to 90 degrees. Because you're never going to catch up with the demand for inclusionary stuff when there's no population of minority here. And it's wonderful that you're doing things for the population that is here and for the lower income folks. But guess what? It's a cycle of despair. You're never going to get there unless you say something to the planning board, which is stop funding the developers, because that's where the problem originates. Inequality. You need to stop it, or you are opening the door in the middle of the winter with the heater blasting. It's just not going to happen. I don't know how to say this. It's like stating the obvious. You all know that. You all know that, but why aren't you doing something about it? Because that's your mission. That's in your mission statement. It's not just solving the problem by engaging and opening up to people. It's also solving the fundamental problem, which is wealth inequality. And Boulder is doing it worse and worse every day. I know because I follow 8 city boards and I see it. Over and over. In the PRAB, they're $300 million in arrears because the developers aren't paying for the impact fee. You know what the impact fee is per square foot? $130. You know what they're paying? $13 per square foot for recreation, for libraries, for social services, for all of the things that Human Relations Council needs. So do something. Do something. Say you can't do your job. You're going to disband as an advisory board if you can't get the fundamentals changed. And that's in other boards, apparently, unless you can speak out and say to the other boards. And that means Transportation Advisory Board, Planning Board, and Water Resources Advisory Board, and Open Space Board of Trustees, and other boards that are fighting for the funds that you need.
Thank you, Lynn. Your time is up.
Wealth inequality. So do something. Thanks.
Thank you. And I got the message from Will Sweeney that he doesn't have any comments. So we can, I don't see any other participants who would like to participate at this time. Thank you.
Thank you, Ingrid, and thank you, Lynn. We have two different community participation items tonight. One is the public comment that we just had, and then there's actually we invited individuals who have been funded by the Human Relations Fund. People who regularly attend this meeting will be familiar with that grant making. And we invited people to attend this meeting to share their input, because we've been recently discussing some potential changes to how those funds are made, including potentially that those individuals no longer may have to attend this meeting for applications and reports. Is anybody in attendance to give that input?
Not at the moment. We did have one person who said she wanted to come, so she might yet. We do have a little staff presentation to share the survey results from the survey we gave to grantees, so we can maybe go through that. And then if the community member does join the meeting to give comment, we can make that happen.
That sounds nice. Thank you, Elizabeth.
You ready for that agenda item?
We'll hand it over to you for the presentation.
Okay.
And hopefully they'll give that person some time to join.
And Ingrid, I hate to ask you to do one more thing tonight, but can you make me co-host so I can share screen share?
You are co-host, Elizabeth.
Thank you.
You're welcome.
All right. So can everybody see that PowerPoint slide? Okay, great. So as you remember, we have been talking for a few months now about ways in which to streamline and make more efficient the process through HHS, Housing Human Services, to provide grants to community groups for cultural celebrations and other education, informational, and engagement events in alignment with the Human Relations Commission mission. And some of the reasons that we've been looking at this are acknowledging what you all have shared, and that is that wanting to be able to use your time efficiently at meetings, to be able to keep funding going, but just with greater efficiency for HRC members and applicants, grantees, and city staff. And as we go through this process, here again, just are the values and considerations that we've talked about before throughout this process of looking at ways to improve upon the structure and process. So one of our last, the items that we shared with you back in September was that we would take this month of October and do some community engagement with the organizations that have been asking for and most often then receiving funding through the Human Relations Fund, to be sure that we get their input. And as part of that process, we developed a survey, a very short online survey in English and in Spanish, and sent that out by email to about 40 different contacts that we have in our files for organizations that receive funding through the Human Relations Fund from 2020 through 2022. And from that, we've got 13 responses so far, which is pretty good rate for responses. I think it's safe to say that we can continue to keep that open or reopen it, continue to engage with people for sure moving forward, but we really wanted to be able to have a deadline that enabled us to provide some information to you. The other thing I'll say about the survey before we show you some of the summary results is that we also gave, people could take the survey and be completely anonymous, but we included an option for them to give their name and contact information, either if they wanted to come to the meeting tonight, or if they just wanted to be able to engage directly with city staff to just talk about other of their concerns. And again, I think most people decided to remain anonymous, which is fine. But we did have at least one, if not more, community members give their names. So we'll be really happy to follow up with them. So this is a very busy chart. You may not be able to see all of it, so I'll kind of walk through. But the first set of questions were just about the grant application process. And so we asked, we had a series of statements that you can see here that we provided, and asked people to choose, you know, which on the scale of strongly disagree to strongly agree, which of those kind of best reflected their feelings. So for example, the first one, would you appreciate the option for a Spanish language application? Most people said they agreed with that. That's the long kind of blue bar at the top. Christine.
Hi, I was just wondering, the x-axis, is that the number of respondents, or is it some
Is
other
that right, Ingrid?
metric?
I think that's the case.
That is the
Okay.
case. We had a really good turnaround of surveys, given the number of surveys that we sent out. And yes, 7 people replied, or 8 replied with that answer.
Okay, thanks. I just wanted to make sure I wasn't looking at percentages or something. Thanks.
Right, I see what you're asking. Yes, so 7 people, you know, out of the total replied they agree. They would like to see a Spanish language option. 3 people said strongly agree, and then the rest were just agree, or remain neutral. I think that's the other one. So, so kind of on down. Sometimes there are 3 options, sometimes 4, just depending on what the question is. The next one was a preference to complete the application as a Word document or a PDF and attach it to an email. That is the way that we have been collecting applications through for the Human Relations Fund. And as you can see there, we actually got a range of options there. But more of them are actually, so there were some that were neutral. That's the kind of longest bar there at 5. 4 people actually said they strongly disagree, which means like they don't like to do it that way. 3 strongly agree, and then 1 disagree. So that one was kind of a whole wide range of different responses. But if we look to the next one, which is asking people, do you prefer to submit the grant application through an online form? We had 8 people say strongly agree, and then the rest are either neutral or agree. So even though the previous one, you know, people were either agreeing or disagreeing, that shows a pretty clear preference that people who, at least the people who responded, would much rather submit something in an online form, which is what we do for all of our other funding programs. The next one is whether or not people feel it's important to present a verbal report in addition to a brief written report. And there too, it's kind of all over the place. You have, you know, a couple people strongly agreeing and then disagreeing and then neutral, you know, so it's a little all over the map. And the rest of the responses are a little more then a little bit more clear. You know, we tried to ask the questions in a different way just to gauge if we go one way or another, or provide a combination of options, like, again, presenting a written report without presenting a virtual or in-person. There you have some more people saying they disagree with that. So, you know, one of the things I think for Ingrid and I, that's a takeaway here is that, you know, where there's the most agreement, on the process, just among those first 5 questions, is people definitely would like to have an online form process. As to whether or not the reporting is a combination of written, virtual, in-person, it's really such a broad range that I think that really does kind of give us an opportunity to open the door and say, let's just try something different. You know, what if we only collected a brief report? What if it was a virtual, report? If we decide to do that, maybe that's not a part of a long meeting, right? If we change other parts of the process, that could be very, very efficient, and, you know, not encroach on the HRC's time and not have grantees in a position of, you know, coming into a meeting and waiting and waiting and waiting, you know, something like that. So I think there's that probably is an indication where we do have some room, you know, to try some different things. The next couple of questions are about how we might want to provide these application opportunities. So as you all know, what we do now and have been doing for a while is that each cultural event or opportunity or kind of holiday, if you will, has its own unique fund round. So like, here's the time frame to apply for MLK Day. Here's the time frame for Indigenous Peoples Day, and on and on. One of the options we're thinking about is just having 2 deadlines per year. Anything that's an event, or whether it's aligned with a you know, kind of a known kind of city cultural celebration or some other event on their own calendar. If it's taking place from January to June, here's your deadline. You know, if it's taking place from July to December, here's another deadline. So there too, what we're seeing is actually it's not that different responses to those questions, except that for keeping it the way we have now, which is 1 fund round per every event, actually has 1 person who strongly disagrees. But I think, you know, the fact that nobody disagreed or strongly disagreed with just having 2 deadlines per year, I think is a good, you know, indicator that people are interested or willing to try that. The last question was just about the length of detail requested in the application and whether or not that level of detail is kind of appropriate for the amount of funding we have to give. And I think many people on this call, or anyone else who has submitted a grant application, knows that, you know, a very, very long process for a small amount of funding doesn't seem fair or equitable. And so we actually have a few people who disagreed with that statement. And that is just good information for us to have. Are there things that we can streamline by way of like word count, or just how many questions we ask, or the level of detail? Those are all, I think, really easily addressed with some fresh eyes on this process. So all in all, I think that was some really great feedback so far through these surveys on that piece. We also just had a series of questions about what types of information people who are potential applicants or organizations would want in order to know what funding opportunities are, what support might be available, and how they might apply. And this set of question was kind of a check all that apply. So your question earlier, Christine, about what those numbers represent, it is the number of responses, you know, kind of given, but it's about, but people can choose more than one. So here too, it's just really good information for us. If we as staff really thought that an informational video was the best thing ever, I think these respondents are telling us that's probably not as helpful as some other things that we're going to do. So that's good. Maybe we still do something, but maybe it's not worth the time. So it clearly just shows that, you know, the, you know, frequently asked questions, you know, making information available bilingual, making sure that we have those staff members available to do that one-on-one. That's a best practice. You know, Ingrid has been doing that already. And I think, you know, applicants really know and understand and appreciate that. And it's a best practice from our other funding programs as well. So I'll just stop there. Those are really the two slides we had for the survey. Again, it was pretty brief. We did have some comment boxes as well. And we can go ahead and we were actually collecting surveys yet today. And so Ingrid didn't have a huge ton of time to kind of compile the comments, but we'll definitely have a look at those and be able to share some information about that as well. So let's see, let me stop screen sharing there and see if you all commissioners have any questions, and maybe also just see if our community member is now joined if she wants to speak. And I don't see her. So any questions or comments or input from you?
I just want to say thanks for doing this outreach to the grant recipients. It's really nice to know how they felt about the process, and good to have some indicators about like what we can do to make it easier for people, or I don't know, process they want to engage in more. And that's a really good turnout. That's the other thing I'd say. It's a really good response.
Thanks. Any other comments, Christine?
I just had a question, and also I'm going to echo Lindsay and say thank you for all the work you put into this. Really appreciate it. I was wondering, Ingrid, if just based on some of the comments that you've read, even though you don't have it as part of the presentation, if you got any impression one way or another how people are feeling.
Thank you, Christine. Very thankful, very appreciative of the funding. And that's the general sense. I think, you know, most of these organizations are very small and appreciate the amount of funding and would like to see more of it. But overall, gratitude. And there was a comment regarding the length of the meetings and participating and how that is exhausting in staff that, you know, in organizations that have a small allocated number of staff to do this. That's what I will highlight on
That's
the
helpful.
big scope of things. Mhm.
That's very helpful. Thank you.
Unmute, Elizabeth. Any other questions? Carlos, did you have anything? No. Okay. Beaker, JH. Okay. Well, next steps on our end are to just continue to follow up with survey respondents. And actually, I saw your note, Ingrid, that the community member grantee who wanted to join tonight is not able to. So we will be sure to follow up with her. And then our plan is to just work at providing a more detailed proposal to you all at the November meeting for changing things up. We may at that time have some additional staff members who will want to just pop in on the meeting on our end, who are helping to manage some of our other funding programs, just so they can see you and say hi. But we'll bring back some recommendations at that time. And then our goal would be to have these changes take effect in January 2023. So if we, for example, do decide that we want to just have 2 funding deadlines per year, we would have some time to implement that. And again, the goal would be to not close the opportunity for funding on anybody. And so it may be that it's a phased process or what have you. But if for any other grantees or potential applicants who are you know, viewing or will see this recording later, we definitely want to be sure we're not leaving anyone out. Christine.
Thank you. I just wanted to add one comment, which is that as you're putting together the proposal, the one question I had was about for the applicants for the specific holidays or events, and just wondering historically if the timing of when their window opens and when they get it in, like, I guess my question is, if we only do those twice a year and sort of group them, are there going to be organizations that somehow miss the opportunity because suddenly they have to turn in an application several months earlier than they have been in the past? So just to sort of consider that.
Yeah, I appreciate that. I think that's it's a good point. And yeah, I think we can be sure to look at that. One advantage of that is that we do have a grant management system that we use for other funding programs that allows us to kind of branch off if you enter in and pick what you want to apply for funding for, and then kind of branch off in different ways that can be a lot easier for anybody who's applying or reviewing. So we can provide, for example, different information and requirements if they are different, depending on what exactly they're looking for funding. So that's a great point, and we'll be sure to take that in consideration. Thank you.
Thanks.
All right, I think we're all set with that one. Thanks, everybody.
Thank you, Elizabeth and Ingrid, for all of your work on that. It is really nice to hear back from people. And so we are on we have an item for commissioners and staff response to the open comment and public comment that we just did. And I have a question. I've been on the commission for some time, and I found with Lynn's comment, like lacking some, I think, contextual information to bring that into relevance. And I'm curious if any staff can explain to me, and maybe others who don't know this, what the impact fees that Lynn mentioned are used for.
I actually would want another colleague to get back on those details, because I have some idea, but I also am more concerned that I provide you with wrong information or inaccurate information. But we can, I can commit, we can get back to you in writing just by email to just clarify what she might be referring to.
Thanks, Elizabeth. Other follow-up from any part of the community participation, or open comment, or the input from grantees. Okay, I see. All right. I wonder if we might do a retroactive agenda adjustment, because I see Wendy Schwartz is here, and we have, I believe it's 2 discussion information items that have staff presenting. Am I correct about that? So I wonder if we can.
Yep. And I don't see our other
6.
presenter here, so I think what you're about to suggest is good.
Okay, cool. So I'm hoping that we can bump Roman numeral 6 up. And for those of you who can't see the agenda for whatever reason, we have a Roman numeral 6 discussion informational item on our agenda. And we're within that item, hearing more from staff about both the residential access management program plan, who I believe based on what I can see, that's the staff member who's not here yet. And then we have item Roman numeral 6B, which is the alternative response model that Wendy's here to talk about. And then as a current Roman numeral item 5, we've got an action item on election timing, which commissioners will know that has to do with the letter that Christine shared with you all since our last meeting. So my proposal is that we bump potentially all of Roman numeral 6 up, but definitely 6B, and out of respect for Wendy's time and night and potentially the other staff member. And then since we all have to be here until the adjournment of the meeting, we go back to 5 after we've heard from all of the staff. And the thumbs will be good. I'm seeing some nods. I'm seeing some thumbs. All right, I'm taking it. So like, let's go with that agenda adjustment, and we'll hear from Wendy first. And then we'll see, after we hear from Wendy, we'll see if we are able to hear about the residential access management program plan. Thanks for being here, Wendy.
Thank you, Commissioner Loberg, and thank you to all the commissioners. So we ready to go ahead and get started on this item? Okay, great. So I think a lot of you folks know who I am, but for those who don't, my name is Wendy Schwartz. I am the Human Services Policy Manager in our Department of Housing and Human Services. And so I work with Ingrid and Elizabeth there. And I also manage some cross-departmental projects in the city. And this is one of them, the Alternative Response Program. And so I have a little slide deck here to talk you through tonight, sort of what the Alternative Response Pilot Program is and where we are in the planning stages. And let me see if I can successfully share my screen here to get the slides up. Okay, so I think right now you're probably seeing it with the, see if we can, there we go. You seeing the opening slide right now?
Looks great.
Great, okay. So Community Assistance Response Team, otherwise known as Alternative Response. The way we got here to where we are today, I think what most folks know is that nationally there's been an increased use and interest in alternative responses to what might be a traditional police and or fire response to 911 and dispatch calls, in cases where maybe the underlying issue behind that call is in fact not criminal or not major medical. And often the form that these programs take is the responders will be a mental health professional and an emergency medical technician, otherwise known as EMT, or a paramedic. And so it's a case where a law enforcement professional does not go on the call generally. And some programs that get talked about a lot, there are certainly more examples than this, but frequently ones that we hear referenced are the STAR program in Denver. And that started in the middle of 2020. So that's just a couple of years old. And then CAHOOTS in Eugene, Oregon, which by contrast has been going in some form since 1989. It's really considered kind of the nation's flagship alternative response program with a really long history. So locally here in Boulder, we've had a lot of feedback from community members that they are really interested in the city exploring a program here in Boulder that would be similar to STAR or CAHOOTS. And I was here a month or two ago with one of my other hats on, which is the project manager for the Reimagine Policing Project, otherwise known as the Police Strategic Plan. And one of the pieces of feedback we've heard through that community engagement process is that people are really interested in exploring these types of alternatives. And then our city council is also very interested in this program option and has asked us to look at that. So what we've been doing since early in the year is we have a city team of 3 departments. So that's Housing and Human Services, my department, as well as our Fire Rescue Department and our Police Department, meeting to talk about what a pilot for alternative response might look like in Boulder. And I think some folks might be wondering, about police being in the planning of a non-police program, but obviously everybody needs to coordinate about what they're responding to and what they're not responding to, and really understand what everybody's going to do when different types of calls come through dispatch. So it does take planning with police, even if it's a program that police don't respond on. And then another thing that we've done as part of this process, as we've been developing this concept for this pilot alternative response program, is doing some initial consulting with our local safety net healthcare providers. And so these are healthcare organizations that a lot of folks would be referred to through an alternative response program for further care. And so these organizations are Boulder Community Health, Mental Health Partners, and Clinica Family Health Services. One of the things that I like to talk about a little bit is what we've already got going on in the community that's related to alternative response or to a potential alternative response program, because we find that often people aren't aware of all the programs in the community currently. So some things that are already happening, we have our Crisis Intervention Response Team, otherwise known as the CIRT team. And those are licensed behavioral healthcare clinicians that respond with police in a co-response model to calls that come in that have an underlying behavioral health issue. And if there are some folks watching right now who are wondering, what am I referencing when I talk about behavioral health? That's really a more modern term that combines what people would have traditionally called mental health with substance use disorders. And it's under an umbrella now called behavioral health. Another thing that is accessible to community members right now is mobile crisis response without police. And that is dispatched through the Colorado Crisis Line. And I've put the numbers both for the phone number and the texting information here on the slide. And when people call in to the Colorado Crisis Line, which will become 988, then they talk about what's going on, and if it's determined that a mobile response is what's appropriate and desired, that can happen in the community. There is a nurse navigation program that happens through 911 in partnership with American Medical Response, otherwise known as AMR, ambulance company. And so when people call 911 and they appear to have a medical issue that might not require an ambulance ride or a hospitalization, then they can talk to a nurse about what their options are for seeking maybe a more appropriate lower level of care that's going to be less challenging for them and less resource intensive for the community. We have our homeless outreach team, otherwise known as the HOT team. And those are police officers that focus on assisting people experiencing homelessness in the community into housing resources. And one of the things that the HOT team does is partners with Clinica for some street outreach medicine. Be There is a homelessness street outreach and resource connection team run through Boulder Shelter for the Homeless. We have our downtown ambassadors that perform many functions downtown, one of which is assisting people with service connections when needed and desired. And finally, Mental Health Partners has an assertive community treatment team, otherwise known as an ACT team, which is a multidisciplinary team that goes out into the community and serves people with very high needs, who need multiple team members to connect their social services needs, their mental health needs, their physical health needs, etc. So as we have been working as a staff team to develop the broad strokes of what a pilot might look like in alternative response, then we've developed 4 high-level draft goals that are here on the screen. And the first would be really increasing that efficient use of first responder team time by diverting calls that could be better served by an alternative response, increasing positive health impacts for individuals, and avoiding continuous emergency services calls through connection to ongoing services so people can be served in a different way. And it looks like, Lindsay, you have a question?
Thanks, Wendy. Yeah, I find myself wondering, because I heard you say earlier that when a call is not criminal or major medical, it might get diverted through one of these existing services or one of the ones that we're talking about that's proposed tonight. And I see here in number 1, you're talking about first responder time. So when we're talking about a medical concern and not a criminal concern, are we talking about first responders like EMS, or are we talking about the police specifically?
So, I'm sorry, Lindsay, could you repeat your question?
Totally. Yeah. So I noticed early on in your presentation, you said that the models that we're talking about tonight might get employed if a call is not criminal in nature or major medical in nature. And you talked on the last side about these already existing services where, like, for example, a nurse might be called, or the mobile crisis response might be appropriate if there's not a major medical concern. So in those cases, when we're talking about a concern that may or may not be major medical rather than may or may not be criminal, are we talking about first responders like EMT or fire rather than police?
Yeah, so in those cases, it's a question of like,
Sí, en esos,
fire personnel really need to be dispatched? Does an ambulance really need to be dispatched? Or could there be some more appropriate resource, you know, if it's a lower level issue, you know, perhaps the person needs stitches and what they need is maybe not an ambulance ride and spending a bunch of time in ER, maybe, you know, urgent care could suit their needs, etc. And I definitely, you know, can get, I mean, I think more information, you know, for you if it's desired from our fire department, because they're a little bit more deeply involved in, you know, looking at those types of calls. But yeah, there's both, there's, you know, the potential to, you know, make more efficient use of both our police and our fire personnel time, as well as some services that are contracted. So for instance, our ambulance services in the city are contracted.
Thank you.
No problem. And I think we were on about goal 3 here. We left off cost savings from reallocated responder time to preventative community work, and increasing health and service engagement by ensuring referrals to the most appropriate level of care. When we think about the types of services that we would consider this pilot program providing, The first one is the one that really everybody thinks about and is well known through other programs like STAR and Cahoots, and that's that basic community response, the actual response to the types of calls we just talked about, low acuity behavioral health, human services, medical calls that don't involve safety concerns. And as we've been exploring the idea behind doing this alternative response pilot, one thing that's really come up is some of the support that's needed after that initial response for some people, especially if they've got multiple complex needs. And they're going to have a really hard time in some cases following up with that community healthcare referral or that connection point just because their needs are so complex. And so what we're going to propose is not just having the initial response with the behavioral health professional and the paramedic, but having some intensive case management built into the program for people that do have those complex needs and are going to need a lot of help navigating the system. The staffing that we do envision for the program, I've talked a little bit about it already, but it would be master's level licensed behavioral health clinicians, paramedics, and case managers. Some of the response characteristics, the way this looks is, again, we'd have to do some new screening and training through dispatch so that there's the protocol to sort out appropriate 911 calls or calls into the police non-emergency line for this team, and then route those calls directly to the team for response. Some examples of categories of calls that we've looked at that we currently receive that would be appropriate for this team: welfare checks, loitering, behavioral checks. And we came up on the first data pass with a really high-end estimate of 5,000 calls annually. We don't think it's going to actually be that high in Boulder, because once you really dig through those individual calls, you would find some that for a variety of reasons wouldn't actually be appropriate. But that's kind of what we would see as the upper estimate, if you will, of how many calls potentially this team, or these teams rather, could respond to over the course of the year. So looking at how would we assess how well we're doing in achieving goals for the program that we talked about a few slides ago. So these are some of the potential pilot success measures that we've been brainstorming. And the first bullet there is that we definitely want to commission a formal evaluation of the program, an external evaluation, because this is a really important investment, and we want to see what's working and what's maybe not working the way we hoped it would. We would certainly look at those changes in what police department and fire personnel spend their time on, and is it less on certain types of calls? How does this affect response times on priority calls? If it does, if personnel aren't getting tied up on some lower level calls. We'd absolutely want to look at client satisfaction with the outcome of their interaction with the team. And one thing we've seen when we looked at some things that some other teams measure is questions about how clients feel about their ability to manage further issues in terms of really those connection points, those strategies that the team is hopefully passing on to them. People remaining safely in the community whenever possible. So really, that's a broad strokes healthcare best practice is, you want people to be able to be in the least restrictive care environment possible. Behavioral health and substance treatment referrals, reduced emergency services utilization by people with frequent system interaction, enrollment and follow-up services, reduced hospital and emergency room visits. What are the differences between the pilot and traditional police response, and how do the number of ambulance rides look during the pilot compared to pre-pilot? We've talked a lot about what are some potential challenges that we have to get rid of, that we would love to get rid of, but we'll have to prepare for. So this is something that I think everybody's aware of, lack of what we'd call upstream resources needed by some people. So if you've got the best response team and the best case managers in the world, and that residential treatment program, substance use treatment program, or that housing resource or what have you does not exist, or does not exist in a way that's really accessible or usable for that individual in the community, then you're really going to be challenged on your outcome, because every response program is really only as good as the resources that exist in the community to really connect people to. Certainly program data across multiple organizations, and especially when you're talking about sensitive data like healthcare data, including behavioral healthcare data, that takes some work to get the right data with the right protections integrated and analyzed enough to really both serve the individuals with coordinated care and to really understand how the program is and isn't working. And then another issue is, particularly in behavioral health, there's a national workforce shortage. And that is even more acute for diverse providers. Like if you're looking for providers who speak Spanish or who, just have diverse demographics, backgrounds, that's tough in all the services right now. And as a side note, I just today learned that the CAHOOTS program in Eugene is in the middle of a commissioned evaluation process. And I watched part of their council study session on their evaluation. And when they were talking about some of the big challenges faced by the program, and I had prepared these slides last week, then the three things on this slide came up as big challenges for a program that's been in operation since 1989. So there's good news and there's bad news. We're not alone, but some of these challenges are tough challenges. So next steps, we have a city council study session, December 8th, and we're going to be giving a presentation similar to this to city council, and get their direction on really proceeding with implementing the program in 2023. And then at that point in the first quarter of next year, we'd be looking at hiring staff, doing some of the work in dispatch and data tracking that needs to happen to make the program happen. Certainly ongoing coordination with our healthcare providers is going to be really important because they'll certainly be impacted by this program. And then setting up an ongoing process to evaluate outcomes and making sure we get that equity lens in there and that client feedback to really adjust those pilot services according to the people who are experiencing the services. And with that, I'll go to the final slide, which are the questions I prepared for commissioners. First, does the commission support the pilot concept as it's been presented? And do commissioners have any comments about the program goals and metrics, or any other questions or feedback?
Lindsay, go for it.
Thank you. Thanks, Wendy, for your presentation. I have some questions here. I can begin with one that you asked specifically. One critique I've read about STAR in particular is that a very small percentage of calls to police currently get routed through STAR, and it's a newer program than Cahoots. I've read 3% for STAR, and then something like 17% for Cahoots. So it seems to me like a metric around call routing. If you know, these are the methods that we're considering, or the model that we're considering, would be really useful. And then I have other questions too, but I see some other commissioners with their hands up, so I'll hand it off to, I think Carlos was next, or at least Carlos is first in the stack that I see, and then we can circle, then we'll go to Christine, and then we'll see if anybody else has questions, and then we can circle back to me.
Lindsay, would you like me to answer your question, or before we move on, or?
Oh, please.
The protocol. Okay.
Yeah,
so,
thank you. Sorry, that wasn't clear.
So the percentages that you just mentioned are a really interesting question, because you're correct, that is about 3% for STAR. And if we hit the high end of our estimate, the 5,000 calls, which, like I said, I don't think we're going to hit once those calls get refined, we'd be closer to 6% of the calls that come in to dispatch here in Boulder. And the Cahoots numbers are an interesting question, because what first got published, if you look at the percentage of dispatch that Cahoots serves in Eugene, you're right, it hangs out in that 15 to 20% range. But when they sort through what police would respond to, it comes out in more the 3 to 8% range. And that's partly a function of a program that's been around since 1989, because over the years, what has happened is that people have started to call into their dispatch for services that they would not have called in previously. So, you know, someone who needs a ride to a food bank, well, probably right now in Boulder or Denver, someone's not going to call into dispatch for that. But at this point in Eugene, they might. So, so anyway, I think, you know, the percentages are pretty consistent in that 3 to 8% range with those programs. But Eugene has kind of the unique situation of essentially adding on a set of calls to its dispatch that didn't previously exist. If I hope what I just said made sense. It's a little bit complex with the percentages, but if that's helpful to you.
That was informative, and I'm wondering if we can put a pin in the metric, the metric thing, and loop back to talking about that. I'm sorry, I'm like heavily participating and trying to facilitate, which is sometimes weird. But thank you, Wendy. And I'm going to hand it over to Carlos.
Gracias, Lindsay.
Thank you, Lindsay. For what I see the program, I like it. I think it's very interesting. And yes, I believe as a commissioner of human relations, I am willing to support this program. I like this program, and I feel that it is an interesting one. Thank you.
I apologize for this. I realized midway through Carlos's comments that my translation was not working appropriately, and I fixed it about halfway through. And so I heard the end of the comment, Carlos, that you think, I think you said you think this program would be a good one. But please let me know if there's a question or a comment earlier in the comments that I need to respond to.
No, yo lo que dije fue que
No, what I said is that I am interested. I feel that this is an interesting program, and as a commissioner, I think I will be willing to support it and back it up.
Thanks so much, Carlos. And I appreciate you being willing to repeat, since at first my translation wasn't working, but now we're on track.
Christy?
Thanks, everybody. Thank you, Wendy, for the presentation. I also have a whole bunch of questions, but maybe I'll ask a couple and then kick it back to Lindsay, and then I can pick up again. I also want to echo Carlos. I am in support of the concept of this pilot. I think it's I think any way we can explore alternative responses that are perhaps, you know, more appropriate to what the situation calls for, I think is something that is very important, and I'm glad we are looking into this. I was wondering, you know, we were talking about this being a pilot, and I was wondering what kind of time frame we're looking at. You know, there was a slide you had about what success looks like, and over what period of time are we talking about before the city takes additional steps to either make it no longer a pilot or make changes? And then I also had a specific question when you were talking about the challenges, and one of the challenges being the lack of upstream resources. I was wondering if we already have some clear idea of which lack of resources we think might be an issue.
Sure. So I'll start with your first question, Christine, about the time frame. And so we would want to have a full year of piloting the program and then looking at the information and data we have after that year, so that we could get a better sense of what's happening. We know there are seasonal differences in calls in the community, and also for any new program, there's just kind of some like getting started noise sometimes in the data. And then for your second question about upstream resources, unfortunately, that's a long list. And a couple of them are examples that I mentioned in my presentation, which is housing. And so, you know, we know we've got a significant issue, like many other communities, with people experiencing homelessness and housing instability. And really what most information shows is that it's going to be very difficult for people to make headway on other mental health, physical health, substance use, et cetera, issues that they might have if they're unstably housed. You know, Maslow's hierarchy of needs, we're all gonna like worry about that first and other stuff later, right? Also, substance use treatment, especially if you need more intensive treatment, you need residential treatment. And, you know, and that ties into my first point, right? I mean, if you don't have a stable situation, then showing up to outpatient treatment, that's probably not going to happen. And culturally competent treatment, you know, if you go and do a search on Psychology Today or another referral resource for therapy, for mental health treatment, then you can pretty much, you know, start by like, you know, looking for in your area, and the more filters you put on, like if you're looking for treatment for an adolescent and you need someone that works with that age group, if you need someone that takes insurance, if you need someone that takes Medicaid, the more filters you put on, the smaller your world is going to get in terms of your options, and it might come to zero. So there's a lot of behavioral health care needs, and the Boulder County is working on a project right now for a behavioral health roadmap for the county. And part of that work is really that analysis of all those gaps. But it's, unfortunately, it's a longer list than any of us would like it to be.
Thank you.
I'll jump back in, and other commissioners feel free to indicate that the raise hand is a really lovely feature when we're in this format because it maintains a stack. So if you have a question, please just jump in with the raise hand feature. So I have one clarification question. STAR and Cahoots, they're essentially the same model. Is that right? Like they're the same model across like the scope of models for alternative response programs that are applied maybe in a different way in different municipalities?
Yeah, STAR and Cahoots I would call very similar. I mean, if we want to get a little bit weedier, there's some differences. So for example, STAR has a different set of experience and educational requirements. They have a higher level of experience and education required for their behavioral health clinicians on the team than Cahoots does. And so there are differences, but in terms of kind of the core elements of how the program works, I would call them kind of the same model. We've looked at some other examples across the country, and I think what you find a lot of are programs that are specifically geared toward assisting people experiencing homelessness. And so STAR and Cahoots, when I've looked at their data in the past, anywhere from like 50 to 70% of the folks that they respond to and work with are people experiencing homelessness. But that's not the same as a program that's just devoted to people experiencing homelessness. So there's a lot of these types of programs getting going with a fair amount of variation, but those are some of the best known ones that are like exclusively or almost exclusively, I guess I should say, responding with police. Both of those programs do have times when they get there and then they realize they need to call the police, but they are primarily non-police programs.
And are we, or did you all consider any of those? Like Mental Health First is one that I'm familiar with in Sacramento and Oakland.
You know, we're open to a lot of different configurations because our goals are doing what works the best to help people. But we have our direction from City Council has been focused on implementing a program more in the STAR Cahoots model. And I would say the majority of community feedback that I have seen will specifically reference one of those two programs or both.
Thank you.
I'll just jump in since I think I'm the only one with a hand raised right now. Just kind of as a follow-up to Commissioner Lobrick's questions, you know, while looking at other models in the country, you know, both Eugene and Denver are significantly larger than Boulder is. And so I'm just curious if we've looked into, or if there are even other programs for similarly sized municipalities elsewhere in the country.
So, sorry, I'm just writing down the question so I can also remember later for good information for everybody else. So you're right, the Denver in particular is significantly bigger than us. Eugene is more, they're still bigger than us, but they're a more similar size. And so we'd look at that a little bit more in our weight class, so to speak. One interesting comment that when I was watching the presentation by the consultants that are evaluating Cahoots today is they said, like, it's kind of hard to pull one of these programs off once you get below a certain size, just because kind of the math doesn't work out with the resources required and the community volume. So when we look at our peers, then we're right now with our existing co-response program, our CERT team, we're ahead of a lot of them in implementing things like this. But for cities our size, what I have not seen is a lot that are broad-based, which has been part of the feedback. So in other words, what we haven't heard is feedback that we want another program that's, for instance, just focused on people experiencing homelessness. People are looking, the feedback we've heard is really looking for an alternative to those, police calls right now. So we haven't seen a lot of other models for cities our size that aren't similar to Cahoots or similar to other things that we already have in the city, like co-response or other programs listed on the slide that I showed you before.
Great, thanks. And if it's okay, I have another question. Last month we heard from Police Chief Harold about this reimagining police, and I think one of the questions I have is to what extent we think that this may play into that, both practically speaking, but also the city having recently passed its budget. One of the goals I think in here was ultimately cost savings based on preventive measures that could be done through this program. I'm wondering if any projections have been made, what the math might look like, what we think this looks like long term.
Yeah, so one thing I'll note is that there was some funding passed in the 2023 budget for this program, because as we've been working on it, we anticipated having to build it into our budget. And the projections for the percentage of police calls, we would expect, to our earlier conversation, to hit probably in that 3 to 5% range, like other programs. But it seems like the real question you're asking has to do with, what might we be able to reduce then in other places in the city. And so there's a couple of options there that, depending on how things work out, could happen long term. One thing is there could be some reduced ambulance transport costs if people are evaluated and assisted with different resources on the front end. Another option is, we talked about reallocation. In some of my slides, I talked about reallocation to preventative work. And if you remember Chief Harold talking about kind of those prevention-oriented community partnerships, and really that best practices in policing are not about being reactive. They're about being preventative in partnership with community members. So right now, our police, what the external consultant report about our workload analysis for our police department revealed is that our police don't really have enough time to work with community groups and community members on preventative activities to prevent crime and prevent bad things from happening to people. And that is because they're running call to call in a reactionary way. And so this is a long way, Christine, of saying, I think that what we might not see right away, and especially since we're already 29 officers down in the department, would be, less police officers or necessarily less budget for the police department, maybe not. But I think what we would be able to see is moving toward those best practices of police department personnel having the opportunity to work in a preventative way with community members and reallocate their time from situations where maybe they're not the best resource.
That's helpful. Thank you.
I'm curious when we're thinking about dispatch and how these calls are routed and who responds, who designs that decision-making tree?
Oh, how's that determined?
Yes.
So that is going to be a partnership of police, fire, and HHS. And we also would be using some models, like the decision tree from Denver, for instance. We might as well not reinvent the wheel, right? And then I think, as with anything, there might be some refinement and some adjustment as we go on and we learn. But initially, it would be us working together in our departments to look at what calls we think could be safely rerouted. And as the team gets more experience, there might be some adjustments in there.
Thank you. Wendy, I'm wondering, can we see your question slide again, or your prompting slide to us, please?
Yeah, absolutely. Let me. Okay, are you guys seeing that now?
Did you get a verbal on that? Yes.
See it, thank you.
Just following up on that, could we actually see the slide with the goals again?
Absolutely. Let me. Okay, are you able to see all 4 goals right now?
Yes, thanks.
Okay.
And then if you wouldn't mind if we could see again the slide with measures of success.
Absolutely. Everybody ready to go on to that one? Or does anyone need more time with the goals? Okay, I'm seeing people looking like they're ready to move on.
I personally am just taking some time with these, so I'm you know, just giving others that time too. And curious if you know, commissioners who haven't jumped in with any questions or comments yet. If you want to use that time, please just use the raise hand feature.
Okay. Yeah, I think that you said that this would be a rare occurrence, but do you imagine a situation where a call is rerouted or diverted, but the police are necessary? And how would you proceed in that way, in that situation?
Yeah, so the way they describe this in other programs is that sometimes when there are occasions when the alternative response team gets to a situation, and you know, the way it sounded on dispatch was that there was not a different resource needed, but they get there and they either find there's a weapon or a threat of some kind involved, or perhaps the medical situation is far more serious than the way it initially appeared, and this person needs an ambulance and emergency responders for major medical. And so the way that would happen is that the response team, the alternative response team, once they got there and they realized the situation was different than what it sounded like at first, is they would call back into dispatch and request a different resource depending on what the situation was.
That makes a lot of sense. I brought that up because I worked as a resident advisor at CU, and I noticed a lot of as an RA, the students would really downplay the situation because they didn't want to take a ride in the ambulance for the finance reasons. So a lot of times when we get there, they've really downplayed everything, and sometimes time is of the essence, so it can be really scary.
Yeah, and our hope would be to get the dispatch protocols and kind of that dispatch sense of the call really well honed, so that they would be able to kind of suss out when maybe a situation like that was happening. And you know, I think in both Eugene and Denver, they've seen relatively few they've honed those protocols pretty well, so that it's relatively seldom that they have to call in police or major medical. But you know, nothing's perfect, so sometimes that's going to happen. And and then we have to be ready to bring in a different type of resource.
I guess one last question that I have is, in looking at Eugene and Denver and maybe other programs, what have we learned about maybe things that mistakes or things that were maybe misguided that later on became evident that we have avoided in crafting our pilot? What are some guardrails that we now see that we might not otherwise see without having evaluated other programs?
Sure, that's a great question. That's first of all, that's one of the reasons that we are suggesting from the get-go building in like that intensive case management capability. And in Denver, they've done some subsequent RFPs, some requests for proposal to bring in some additional community groups. We've definitely consulted with our healthcare providers and will continue to do so because we know that this can't be happening in isolation from that part of the system, and that coordination is not going to be simple. So we want to start as far in advance as possible. And we really want to build in good evaluation from the get-go. And like even a program like Cahoots, for instance, one of they're being evaluated now after all these years. And one of the comments from the evaluators in the preliminary report is, there's a lot of issues with the data and not really being able to see what's going on in the program because of the way the data is collected. And we want to also really try and find a way, the best way possible, to capture that client experience, or what they feel like they're prepared to do next. And that kind of end user feedback isn't always easy to get. Sometimes people don't really want to deal with that, but we really want to try and get that feedback rather than other people trying to assume what's working or not working for people in the program.
Thank you.
I think I'll do some facilitator things first before I talk more. Does anybody have, do any of the commissioners have input on these metrics? I find myself really wanting to sit with them more, Wendy. I feel like I could offer some more good suggestions. I heard what you said earlier about the difference between STAR and Eugene, about like the 3 and the 17%, and that there's just like a different type of calls that they're receiving, like perhaps because, I don't know, the type of the community or like how long Cahoots has been around compared to STAR. And I still think it would be helpful for a to measure how the calls are routed, because in the critiques that I've read about a Cahoots type model, most of those critiques are oh, not most of them, but some of the critiques are around the dispatch itself and how those decisions are made, and who they're made by, which I think is another thing to discuss, but it's getting outside of the metrics where I you know, I'm trying to focus the conversation right now.
Thanks, Lindsay. And another thing while we're on this slide that I should have mentioned earlier, that I want to make sure I mention now, is that some of these metrics, frankly, are ambitious, because some of them are things that are difficult to measure. Some of them are things that require either self-reporting by people who maybe don't want to spend a lot of time talking to you about a bad experience they had. I mean, a bad moment they had in their life. Hopefully it's a good experience on the response, but you know, it happened because the person was not in the best situation at the time. And some of them really require being able to share a lot of information that has to do with healthcare. And that's sometimes easier said than done, because even though there are ways to produce privacy agreements, protection agreements, get releases of information, there's still a lot of complexity there when it comes to sharing healthcare information. And for very good reason, there's even higher standards of protection for information related to behavioral health. And so I think our approach is really, let's aim high. And then if we have to adjust something based on what is or isn't immediately available, we can do that. But we're aiming high, and we're aiming higher than Star and Cahoots, frankly, on what we want to be able to report on and measure and link to success metrics. So, you know, just in the interest of kind of full disclosure and transparency, you know, there could be some of these areas where we could run into some roadblocks. But that's not going to keep us from like aiming high. We have high standards, so.
I have one more. Thank you for that, Wendy. And I have one. This isn't fully formed in my mind, but like it sounds like I hear, you know, some of the difficulty, like the like collecting the data and determining these metrics. One thing I'm curious is this client satisfaction with outcome and ability to manage further issues. One thing I'm curious about is if there's a way to ask people if they were met with the kind of professional they needed, or if they got the service they needed. And I think that could look a lot of different ways, right? Like, did you talk with a mental health professional when you needed a mental health professional? I think this is another branch, but were you able to speak with someone? Were you able to speak with someone? Were you able to speak with someone who speaks the language you speak? I think it's another really critical thing.
Yeah. I mean, in the end, really, what people, I mean, people are going to have their own personal situation and personal criteria for what met their need at that moment. And so, for example, you know, we would still want to know if it was a mental health professional that responded to them, but maybe that person did not seem empathetic or helpful or what have you. then it may be, for instance, that, technically the right professionals, so to speak, the right category responded, but if the response did not feel good or helpful to that person, then that's still not client satisfaction with the service, right?
Right. Are there, I heard you say that your standards for training and hiring are also, in addition to the data, like you want to do more than Cahoots and STAR. Are there goals around recruiting people who will be able to meet the linguistic and cultural needs of the people they're interacting with?
Yeah, there are. And that's a goal for us, actually for all of our hiring, including hiring for our CERT team. And so we have 2 new clinicians, for instance, on that team who do not identify as white or do not identify as white only. And so we're really working on diversifying a lot of our staffing, and this program would be no different. We want to do as much as possible to to have staff that really meet the needs in the community. That being said, it's not always simple. It's not always easy. And in this field, there's a shortage of behavioral health care professionals, period. And like I said, it's even tougher when you're really trying to meet those diverse needs. But that's a very, very important recruitment goal.
Thank you. And we've heard that consistently talking about hiring in general. Other input on measuring pilot success? Or goals? Which I think we already moved on from. Okay, then Wendy, could you move us one more time over to your prompting slide to us, please?
No problem, no problem.
Thank you. So we heard a little bit from Carlos, and we heard appreciation for this work, but circling back to, does HRC support HRC support the pilot concept? I am seeing a thumbs up from Christine. I heard thumbs up from Carlos. Seeing thumbs up from Vicar. I have some, well, I think 2 buckets of things that I'm thinking personally. And one is I would like to see some modifications, and that's one bucket. And then I'd also like, I recognize this is and this I have a process point question about our role as HRC, and just curious, and maybe I'm a lone person here, right? But I'm curious about the role of HRC, because I heard Wendy, I heard you say that the direction from City Council to staff was to explore a program like Cahoots and STAR. And it seems like you've really done a lot of really thorough work into looking at a program that's like Cahoots and STAR. And one thing I'm wondering about is if, like, I'm curious about the thinking behind that direction, right? If council was aware of other models that exist, and I'm curious about, because I know that there are some limitations for our charge, right? To we can make recommendations to city council, and city council directs the staff. We don't direct the staff. We have to, what I feel like I know from my time on the commission is if, like, we as a group diverge from that initial direction, we actually have to go back to city council and say, like, hey, we heard this really like thorough presentation from Wendy on exactly what you asked Wendy to do. And we actually hope, like, you could consider some other models too. And I'm just going to let that sit for a minute. I'm not sure how the process works, and I'm going to hand it over to Christine.
Thanks, Lindsay. So I guess I want to clarify that I do support the concept of the pilot, because I do feel like we are overdue as a city for exploring alternative methods of response, and so I'm very much in favor of the concept of the pilot. But I also agree with Lindsay's line of questioning. Just sort of, it would be helpful to understand a little bit more about that.
Commissioners, if I can jump in and maybe I can make a suggestion. I mean, we don't want to be unnecessarily limited, if you will. I mean, you know, good ideas to help the community are good ideas to help the community, right? And so, and I think, like, what we try to do is be kind of goal oriented, right? Because it's less about the, you know, the program, if you will, like we want this model of program or that model of program. It's more about, like, what are the goals that you're hoping to accomplish with that program? And so my suggestion would be, if I heard Lindsay mention Mental Health First from San Francisco, and I think one nice path forward, depending on the opinion of the commission, would be that if you folks want to give me your suggestions for what other things you're interested and why, then I could take that back to the team, the team that's working on this, the 3-department team in the city, and we can discuss, like, what's feasible and, you know, what could look into more. There might be some ideas that we can include in our council memo because, you know, if we explored one of these other models and we were thinking, well, geez, this is a much better fit for Boulder and for the problems we're experiencing, then as staff, we would definitely want to recommend that to council. I mean, council can always say, no, please do this other thing. But as staff, we want to recommend what's best for Boulder. And so, you know, so I think if you want to let me know, like, you know, what you're seeking in terms of kind of that additional exploration, then, you know, then let's look into it as staff, and we can circle back to you because, again, we're interested in the most helpful options for Boulder and being able to present those to council.
If I may jump in just real fast, I agree with Wendy. I think you shared earlier, Wendy is going to be presenting presenting, it's getting late, to City Council next month. And that memo is a good, as you all know, we've got to provide memos to council ahead of time, a presentation. And I imagine they would want to know about this conversation, the questions that you're asking, the issues that you're raising. And it's important for us to relay that to them and to really have, enable you to have some kind of conversation even in that way with City Council as well. So I would just echo Wendy's suggestion that, either directly or Ingrid and I can certainly help gather comments and questions, any others from other than the notes we're taking tonight that come to mind. And I am guessing that Wendy would also be happy to come back at some point after the council meeting, even if it's early in the year and the new year, to kind of share the status or any other community engagement opportunities there will be.
Absolutely, absolutely. And again, as a staff person, what would be helpful to me is, so to use the example of a program Lindsay mentioned, what would be helpful to me is like, not just, let's look at mental health first, but it's like, is there something specific about, your knowledge of that model that you're really looking for Boulder for an outcome? And that's, that's why you're interested in looking at it. Because those types of hopes for outcomes really help us to look at those other programs or ideas in the right lens, if you will.
Thank you, Wendy and Elizabeth. That's really helpful, or I find that really helpful. So to summarize what I'm hearing you say, you're looking for more input about what outcomes and characteristics from other programs that we find compelling or helpful or useful to consider. And we should send those to you, Wendy, ahead of, with enough time for you to prepare your memo for the December 8th meeting. I think all of us, regardless of how long we've been on the commission, are pretty like unaware of those timelines. Can you let us know about when you would need that in order to prepare?
Sure. So I have, I've got a deadline. I've got to turn in the final memo, all locked down, by November 18th. And so what that means is that, and when you folks, so I'm going to need, if our team is going to look into other options and do some of that investigative work that you folks are interested in, then we would need a couple weeks in advance of that to be able to look into the information and really have a conversation about, does that change our staff recommendation? Does that, do we think that has the potential to meet goals in a different way? And so, we are here tonight on the 24th of October. And so I think, we'd really be looking for that by, in like the next week or so, to hear what you folks are hoping for us to look into that's different than kind of the Star Cahoots model, and what your hopes are for those alternatives in ways that they might work better for Boulder.
Thank you, Wendy. I appreciate that. Okay, so there's some follow-up with Wendy on our action items for those of us who it sounds like I have some input, and anybody else who has any input. So I can actually take on checking in with commissioners outside of the meeting to see if they have anything to add to. Wendy, thank you so much for being here and presenting the proposal and the research that you've done to us. We really appreciate it, and I'll leave a little space for anyone else to jump in with anything that feels really important before we move on to our next item. But thanks so much for being here with us.
Thank you, commissioners, for your time tonight. It was really great to be able to discuss the pilot concept with all of you, and absolutely look forward to getting any further input you have next week. And always feel free to reach out to me with with questions or comments, because I want to support commissioners as we're all really working together for the city here.
Thanks, Wendy.
Thanks, Wendy.
Thank you so much. Have a great evening, everyone.
You too. Take care. Okay. Back to our retroactive agenda adjustments. Thank you all for your input on that item. Retroactive agenda adjustments. We also have a staff presentation, residential access management program plan update and input, otherwise RAMPs. Elizabeth, do we have the staff member?
So Ingrid actually reminded me, we actually don't have Samantha Bromberg here, but we do have the questions that she posed in the memo that were in the packet. So we thank you, Ingrid. We'll just kind of screen share the questions again, and if you have comments that you just want to share, we're absolutely can take those down and have them as part of the minutes. If you wanted to, reach out to her after the meeting and provide any responses to the questions, that would be fine too. The questions, just briefly, as Ingrid is scrolling through the document, are there they are. Do the commissioners have any questions on the implementation of performance-based pricing or RAMP strategies? Do the commissioners have any questions or input on the next steps for RAMP and the associated trail access management work group? And do the commissioners have any questions or input on the results from putting RAMP and performance-based pricing through the racial equity instrument? So if folks had a chance to read the memo beforehand or need a minute to, to do that now, or maybe if you have read it already and kind of have some questions and observations to share, that would be great. If people need more time, it may not be a great use of time at the meeting tonight to have people do that, but I think that's up to you and Lindsay, how you'd like to move through this piece.
Yeah, thank you for that, Elizabeth. It might be good to just kind of get a little temperature check from people, because this was a big report. I myself don't have like a really, comprehensive transportation and like land use background. So some of it was really some of it was really difficult for me to get through, and I skimmed a lot of it. And one thing that felt useful was having the completed racial equity instrument in the plan. And I noticed that one of the questions specifically is about this. And that's on page 50 of not our agenda, but I think it's like the number 50 on the packet, which is really just like the number for this report. My question then is, do commissioners, do you feel prepared to discuss this, or would it be beneficial for you to spend some more time on looking over the either the report or the racial equity instrument, which seems most relevant to us. Christine.
So I would say I have skimmed the top third of it and have not finished skimming the rest of it. Never mind actually done a thorough reading. So I do not feel prepared to discuss this evening.
Thank you for setting. Oh,
I am in the same place as Christine.
Apoyo a Christine y a Fikir.
I support Fikir and Christine. I read more than half, but I do not feel prepared to discuss it. I think we do need a little more time to be able to thoroughly read it and have the responses and a discussion further on.
thank you, Fikir. Thank you, Carlos. JH, any input from you?
What do you say, Lindsay?
Are you excited to have a conversation about this ramps item?
I am, and you know me, I listen more than I talk, so I'm just paying attention carefully.
Okay, cool.
Okay,
Thank you, JH.
thank you.
Yeah, you're so welcome. I think then it would be best to follow up with staff over email. Elizabeth, am I right about that?
That's
For the
fine.
next meeting?
That's totally fine. We can let our colleague know. You just all needed more time. There's a lot of information to go through, and you're right. It can be pretty, just pretty heavy. So if there are any conversations that you might want to have with her, it could be a quick, check-in with Lindsay and Carlos. It could just be an email exchange. Please just let Ingrid and I know what you'd like communicated.
Thank you.
No
Elizabeth.
problem.
And then I just, the way I engaged with this, because I did skim it first, and then I saw the racial equity instrument was on page 50. And then I kind of just started there and I read the racial equity instrument. And if there was anything like I was curious about in the rest of the report, I referenced that just because it seemed like the racial equity instrument was the most relevant thing to our work. And I'm curious if staff or anyone, commissioners who might have a more complete understanding of ramps. I don't know, maybe jump in if you think oh, that's a reckless approach. But for me, it just seemed like a time efficient approach. I feel like it helped me bring the input that I might have as a member of this commission into context and relevance. And so I figured I would just share that with the rest of the commissioners because this is a dense report. Elizabeth, do you know anything about our timing?
Yeah, the timing is actually pretty short. So, I mean, I think obviously would speak for themselves, but I think it's safe to say that staff would welcome any input, any and all input from the HRC per the questions in the memo. And it's not a bad idea to just focus on that, racial equity instrument, if that really kind of helps you kind of frame your comments and think about it and go back to the other parts of the packet and, kind of do it reverse in that way. If that works for you, please do. I believe Samantha probably, I'm not sure exactly which date, would have to submit it this week, usually on a Thursday. So I would suggest that if other commissioners do have time, you know, off outside of the meeting, whoops, kitty cat wanted to say hi, to go ahead and do that as soon as possible. And again, you can share questions or comments with Ingrid and I, we can get them over to her, or feel free to communicate with her directly. Thank you.
Thank you. Okay.
Good.
I think we're good on that item.
Right.
And then we have a staff update in 6 discussion, or Roman numeral 6 discussion informational items. I'm wondering if we can just wrap up Roman numeral 6 with the staff update, and then we can circle back to our action item with election timing.
Sure. And I can make this pretty brief. I just have one slide to share. And I'll just say while I'm bringing it up, any questions that you have afterward, we'll obviously can send this out in the send the slides out as an email afterward. Let me just go to the right page. Oop. So just a couple of comments citywide. Christine, you mentioned earlier that the city about the 2023 budget. It did pass at the city council meeting last week. And so just wanted to let you all know that if you as an HRC are interested in having a short briefing about, you know, what that budget looks like, you're obviously more than welcome to watch the city council meeting. The link that is in this this slide will take you right to the 2023 budget page where you can, you know, read all about it. We have a new budget platform, an online platform called OpenGov, which is designed to be a little bit more user-friendly and transparent about what the components of the city's budget are, telling some actual more of a story, some narrative about what the projects are, what are some new, you know, items to highlight, etc. So we encourage you to have a look, and if you're interested in having a presentation or a discussion at an upcoming meeting, we'd be more than happy to do that. We can also just specifically highlight some elements of the HHS or the Housing Human Services budget or any of it. So please just, again, let me know if that's something you're interested in, actually having a presentation and discussing at a future meeting. A couple of other notes. Again, this is just really some highlights that we thought you might be interested in. At the city council meeting coming up this week, there has been a subgroup of city staff member and board and commission members across boards and commissions that have been working on recommendations to improve the board and commission process. And that's going to be presented to council. Lindsay may recall, and I'm not quite sure, maybe Feker and JH as well, that this is a process that Clay had provided some input on. Ingrid has provided some input on to the citywide team. So anyway, in this slide, which you'll receive is just the online link where anyone, including you all, can watch city council meetings if that's a presentation you're interested in. And obviously, we and other staff will be reconnecting just on these topics with board and commission members in the new year. And then another note is that we've, been in this virtual space all during COVID, except for the retreat back in August. And starting in the next couple of months, boards and commissions are going to be able to go back to a hybrid model. And Ingrid and I have both been getting more information from other colleagues on what that process will look like. And so you can stay tuned for more information and guidance from us on that. And then a couple of other things. just some key HHS or Housing and Human Services issues. Also at the City Council study session coming up this Thursday is going to be a presentation from our staff, colleagues on the inclusionary housing policy, and to get some input from City Council on that. It is an issue, again, we were just talking about kind of the complexities and the dense or heavy nature of the information about the transportation, the AMPS plan. Same could be true for things like housing policy, but it's obviously something that's a major focus of our department, and making sure that there are affordable housing options in Boulder. So if that's something that you're interested in or would want to have some separate conversation or information about, please let us know. I sent a note out to our HRC grantees last week, and copied you all on the survey that we discussed earlier. Along with that was a flyer about some mental health trainings that are available to our nonprofit agencies, to city staff. And I would just really encourage any of you that want to take part in any of those trainings. We are offering them free through a partnership with some other government agencies and mental health partners. So please spread the word on that. And lastly, as a heads up again, which we're more than happy to have some other discussion on and get input on these from the HRC, we're moving forward and within our department and as a part of the city with making recommendations and allocations through the American Rescue Plan Act, or ARPA. That is the current stream of funding available from the federal government to support COVID-19 recovery, response and recovery. And we have several investments that we're already making to help people who are low income, who are experiencing disparities, economic, health, or otherwise from COVID. And that includes a water utility assistance program, funding going out for financial assistance. We have something that we're very excited about, a pilot project that we are working on designing and hope to launch in early 2023, a guaranteed income project, which gives people who need it money, no strings attached, as a pilot project. We're going to be one of around 100 municipalities in the country using local, federal, or a combination of funding to make that program happen. And so that and other mental health, childcare, other projects that we're planning on launching and supporting through these ARPA funds. We're going to be presenting on an update on all of that to City Council on December 1st. And so it's just another heads up. And if there are some areas in there that you're particularly interested in, please let me know. And we can either come back at an HRC meeting, just provide you with some information to consider otherwise. So that's what I have for an update. We have a lot going on all the time, but anybody have any questions or comments on these items?
A lot going on, a lot of good stuff going on. I'm really excited about the Guaranteed Income pilot project. Cool to hear about that. Oh, Christine, so sorry. I see you were off mute. I think I might have jumped in ahead of you.
No, it's fine. I was going to say at that Guaranteed Income pilot project, I also think that sounds very exciting. So I would definitely be interested in learning more about that.
Let's plan on it.
Yeah, I would really like to hear more about that. And then the other question I had, and I don't know if this is the right place to bring it up or maybe later, but we're talking about possible hybrid meetings in November and December. And if I recall from last year, our pre-scheduled meeting dates in November and December tend to run right up against the holidays. And I know that last year we made some adjustments in our schedule just to accommodate for people just not being able to make those dates. So I don't know if that's something we should just work out over email later or discuss now, but I just wanted to raise that too.
That's great. We actually, yeah, so the dates that we have, thank you, Ingrid, that would be the dates for the meetings are November 21 and December 19, which fall before, but still relatively close. So maybe we can work off outside of the meeting just to either confirm that those dates work for folks or propose an alternative. If we did, it would be moving it earlier rather than later, which feels like that's tomorrow to me, but we certainly can accommodate, you know, if that's going to be a challenge. Thanks for bringing that up, Christine. Carlos.
Sí, yo quiero mencionar sobre
Yes, I'd
este.
like to mention something about this program that I think on Thursdays, I think we have a meeting about this program for Ponderosa. Krista Lauder.
That's actually a
The
different one.
The
Yeah.
Ponderosa manager is going to be there.
It's not the same.
It's actually different, but I'll mention what that is as well. So yes, Carlos is going it's another ARPA or American Rescue Plan Act project that will focus on second mortgages, kind of a revolving fund that community members primarily in mobile home communities would have access to. And so that's another project we're hoping to launch if we get the green light from City Council. And Carlos is one of some community members that we're connecting with just to get similarly, like, here's the project idea, what are some thoughts about burden, benefit, kind of applying those racial equity questions to it. So thank you for reminding me of that, Carlos. Well, that's all we had for the update. Actually, you know, Ingrid, I'll just say really quickly, has been doing so much, including having gone to some conferences and meetings. Ingrid, I should have thought to have this on here too, on immigration. And maybe if there's time, she would be willing to share just a little bit about that experience. But that's all I had for now.
Thank you, Elizabeth. Will now be the right time to do so?
I think now would be the right time, Ingrid, because I imagine that our action item Roman numeral 5 will be pretty quick, because Christine did a lot of work checking, like making sure that like everybody had a chance to contribute feedback to the letter already. So I think this would be a good time.
Beautiful, and it's actually not extensive. It was interesting to attend last week, 2 weeks ago. Time flies by. To a roundtable on immigration and refugees matters, where municipalities across the Front Range met in Denver, and there was a very clear desire for municipalities to really continue ongoing communications that is not only once a year, where we get updates on where are we at in regard to public charge and also DACA status and refugees influx. So all that to say that there's changes that are happening as we speak that also need to be, messaging should be consistent across municipalities to avoid confusion, and even creating strategies and contingency plans as things are changing rapidly. DACA right now is on the line, and there's potential changes that are coming pretty soon. So creating strategies to support communities will be crucial. And then there were some really positive changes to public charge that, so creating strategies to communicate that to the community that are streamlined is ideal. Collaborations was highlighted too. So it was nice to see people from Longmont and more of the close neighbors that we have that are expressing that desire to communicate and get more collaboration to support these communities. It was a very basic orientation and very basic updates of what's happening, but there's a desire as well for municipalities to learn more about the specifics and the nuances of these issues. So there's more to come. There's more conversations to happen and more collaboration. So it was really good to be connected with those who are in alignment with elevating and supporting all communities.
Ingrid, I have a question, if I may. Thanks for that report. It sounds super fascinating, and I kind of wish I could have gone with you. I'm just curious because in the last 12 months, 14 months or so, there have been like two really large global events that have caused a refugee movement around the world, you know, specifically Afghanistan and Ukraine. And I'm just wondering, like, what was discussed about how refugees from those two places are being, you know, integrated in the Front Range. And, you know, they're just like very large global events that I think people didn't necessarily anticipate and were surprising when they happened.
Right. And I have to say, Christine, that was not necessarily spoken that way. As I said, a lot of municipalities came with very different approaches and different information and different levels of knowledge about what's happening in their own municipalities and throughout the state. So it was a very aha moment where everybody was like, wait, you're doing what? What's happening here? And so having that cross information was great. I have to say that the city of Boulder is looked after, and that was, you know, nice to be in that seat, right? Where other municipalities were wondering about, wait, you have a language access office? What does that mean? How does that work? Do you have a racial equity plan? Can we learn more about it? So we are at the forefront of a lot of advancement in terms of serving diverse communities, and yet there's so much more to do, right? So Longmont and Boulder, we look at each other like, yeah, we're more in sync in because of proximity as well as the issues that we should be more informed about, and the influxes that we don't should be following closer to as well. So yeah, it wasn't that was not addressed. I'm sorry, Christine. And there was so much more that was discussed though.
I know, that's just super interesting. I was just very curious. But but it's nice to hear that that others are looking to us to see what they could be doing.
Yeah, and there was more than local government. There were agencies, there were a nonprofit. So I think the roundtable is open to learn, you know, there's place for a lot. There's place for people to collaborate and really build a strong foundation to better serve communities. Yeah, and I'm happy to share materials because I got licensed to do so. So if you're interested, I can share that.
Thank you, Ingrid. Sorry to
You're
put you
welcome.
on the spot.
That's okay. I'll keep taking minutes. Bye.
We do also provide, as I think you all know, funding to organizations that provide support for our immigrant community members, and yeah, have sought their advice and guidance and made sure, you know, when we had Afghani refugees coming to this area, and again with Ukraine, just making sure we're keeping tabs as city staff on what those refugee kind of resettlement agencies are doing, and what, if anything, we need to be aware of to support. All right, now we're done with the staff update.
Thank you. Thank you, Elizabeth, and thank you, Ingrid. Christina's fixing an audio issue, which might be really critical for our next item up, because Christine was really leading that item up. The election timing letter to City Council. Christine, are you able to hear us? I'm gonna ask once more. Christine, are you able to hear us? Okay. I'm gonna move us on to Roman numeral 7, and then we're gonna loop back to action. Okay, Christine, never mind. All right, so we're going to loop back now to Roman numeral number 5, action, our only action item on the election timing letter that Christine shared with you all. And that we need to decide tonight whether or not to send this to City Council. So I'll hand this off to you, Christine. Thank you for your work on the letter, and we'll let you take it away.
Great. Thank you, everybody. So I think you all received messages from me late last week with a draft of the letter, and I thank you all for taking the time to read it and offer feedback. I guess I'm not deeply familiar with the process around what we need to do. Also, I think you've all received a copy from me, and I think you've all seen identical copies that incorporated what feedback there was, but I don't know that it's been sent through the HRC email or is part of the packet, or if we can simply just go over it now together. I don't really know what the process is. So I guess two things. One, is there further feedback? And then two, Elizabeth and Ingrid, I don't know what the process is around this.
I think once you've decided on the final letter, that we as staff can just enable delivery, right? I mean, I don't think we're violating anything by forwarding and kind of an official email on behalf of the HRC. So.
Got it. Okay, so I guess maybe before we get to any decisions, is there anything anybody wants to offer as feedback or to discuss? I suppose for the sake of the minutes, I'll just maybe sum up briefly what the letter says. That might be helpful. So I think we as a body are not permitted to take a position on behalf of the city, but we are allowed to urge City Council or encourage City Council to do so. So this is regarding Measure 2E, which is on the ballot right now for the election that is happening right now. Hopefully people have received their ballots already. And the measure is to change municipal elections to even years to coincide with state and federal issues as well. And in this letter, we've drafted, we explain the reasons why, namely that it will increase voter turnout, and in particular, it will increase voter turnout with underrepresented groups. Just one other question around the process also. We have a Spanish translation, and I had asked, I know someone who's a Spanish teacher who went through and cleaned up the translation, and I hope it is considered a sufficient translation. I guess that's also a question for Elizabeth and Ingrid, if we should approve it tonight, if it needs to, or if it can go through official city translation. It cannot. Okay.
No,
So-
that's one of the
Okay.
things I think we can't do. Sorry.
Okay, so hopefully it was a good translation. And so I guess that's really, those are the basics. I wanted to know if anybody has anything they want to discuss about this, or provide any additional edits that we could do or not.
Mine is a really fine point, just kind of like piece of historical knowledge I'd like to share with the group, because it's from my earliest days on the commission. And around that time, there were some community groups who were interested in advancing non-citizen voting. So I have a fine point suggestion to just replace citizens or residents and citizens with residents, because I think that like nothing's lost if we do that. And if I think those groups have mostly like put down those efforts for the time being, but if they ever pick them up, we don't like unintentionally undermine them with our word choice.
That's great. Thank you, Lindsay. I know you had provided some feedback specifically on those places in an earlier draft. And so I took all that feedback and made those changes. I do believe that there might be one or two places where citizens is mentioned, but we also say citizens and residents. So I'm hopeful that we've addressed all those fine points. If you feel like we need to make further changes, I think we would have to go back and retranslate it. So that could slow us down a couple days. And so my feeling is that given the timeliness of this, we should, I would be in favor of moving forward. The other context I wanted to provide to everybody is that I think it was a week and a half ago, City Council did take the step to endorse certain county measures, but they decided not to make any comment on city measures, and they may or may not choose to do so. So we should sort of understand that it's possible that that may not happen, but nonetheless, do think it's important for the HRC to reach out to City Council in this way.
I have a response. I'm fine with that. Thank you for integrating my concerns with that verbiage. And then I just want to throw support behind what you said. Like, I think even if something's unlikely to happen, in general, it's important to say something in general. So I'm really supportive of that in general. If an issue feels important to us, we should just do something similar to this, regardless of the likelihood of outcome.
I just want to note for audio that Vicar wrote in the chat that I accidentally misspelled her surname. So that is a very important fix, and also a very fast fix, and one that does not require additional translation. So we can very easily, after this meeting, amend that.
Thank you, Christy.
Sorry.
I think then if there's no other input from people and it sounds like commissioners have already had the opportunity to look at the letter, we can make a motion to approve. Just second, everybody approve, and then it sounds like Elizabeth or staff. Elizabeth said that staff should have no problem just forwarding this along.
Yeah,
So-
and I will check in first thing in the morning just to make sure that's right. But yeah, if you just want to let us know when you have that, and if it turns out it needs to go directly, then we'll let you know.
And Elizabeth, would it, I'm assuming whoever makes the motion to approve, it would be a motion to approve with the spelling correction on Ficker's name, but also would we need to change the date to tomorrow?
I don't think so.
Okay,
Not if you're approving something right now with that change.
okay,
Yeah, historically, we don't need to do that.
okay.
I agree. Okay, motion to approve.
Yo pido que de
I would
acuerdo,
ask that
eh,
in accordance with all of you,
votemos para
that we vote
llevar a cabo esta carta a
to
la-
go ahead and give this letter to the members of the
la mesa de ay,
board.
bueno,
Thank you, Carlos.
en fin. ¿Alguien secunda mi moción?
Yes, anybody wants to second my motion?
I second that motion.
Okay, and I'll say. And then JH,
Aye. I'm watching.
Gotcha.
Sorry, when I hit it, it doesn't work.
Thank you, JH. Okay, great. So pending the spelling change that we talked about, Christine will send on to Elizabeth, and Elizabeth will send on to City Council. And if that can't happen, Elizabeth will let us know.
Indeed.
Thank you. And Christine, just want to say thanks for all your work on this letter. I can tell it's really thoroughly researched. Appreciation for you for doing this in particular, and then also kind of just like serving as an example of a commissioner like taking up an issue and making a like leading a recommendation to the City Council. We appreciate it. Okay, and then we are on one of our last items, the framework for discussion on protected classes. And it's been some time since we discussed this item. This was one of the items that kind of got that was on, it wasn't on our initial work plan, but it came up in the spring. Outgoing Commissioner Art Beagle shared with us on the commission an article about other municipalities that were considering including homelessness as a protected class. And at that point, the commission and some commissioners started having conversations with community members mainly, or groups or representatives from external groups about what that might look like, what the impacts of that would be, both like intended and unintended. And then Commissioner Fiegel completed his term. And then we had quite a considerable turnover of like both commissioners and staff. So Ficker and Carlos, if you remember, like this was kind of in conversation when you joined the commission, and along with some other items, we were having these conversations. And one thing I think that like maybe even everybody felt was like wait, we need to know more. And then on the city end, there was like a sense of like okay, we need to like reorganize capacity. And that's kind of like where where conversations have been based for the last several months. And that's where we're at right now. But we wanted to pick up this item because it was one important one left kind of hanging during some of those transitions. So that kind of just brings us up to speed on the background to what brings us to this moment right now. Does anyone have anything really just to add as far as context? Okay, in the interest of time, I'm going to move on. And oh, Elizabeth, I saw you unmute yourself. I'm going to hand it to you.
Oh, I was going to say, I've got did you want to go? I've just got like a little slide with just kind of recapping some of what you just shared, Lindsay, if that's helpful.
Awesome. Yeah, I'd love
just to kind of get some next, what kind of desired next steps or elegant next steps, as I like to say.
Thank you, Elizabeth.
Yeah, so and part of this again is that when Clay left as staff member and I came into this role in Ingrid and still kind of a relatively new role, trying to backtrack and kind of understand where we are now and how we can be helpful in making sure you all follow through on this issue if it's something of interest, and in a way that is kind of that part of that context is mindful of the what else is kind of happening in the realm of homelessness in the city, which is a lot, as you all know. And so one of the things that we think was really helpful, I think you all indicated it was why we had Lucas Markley come to the retreat and just kind of give a very broad overview of the Human Rights Ordinance, like really looking at what that background is, what's included in the ordinance and why, what isn't there and why. And it may be helpful to just probe a little bit deeper on that like broad contextual level, and look at, the history of the Boulder Ordinance, that of other cities, possibly, maybe including, some of the locations that had considered or have implemented an expansion in protected class. Ingrid and I, in some of the conversations that we've had with some of our predecessors who worked as HRC liaison in Housing Human Services and our Human Rights Office for a long time, have shared their perspective and their longer history in the role, and why, for example, the Human Rights Ordinances tend to focus on individual characteristics and identities, less so on one's circumstance or situation. So again, that may be just on, kind of hearing from some of that background, maybe more than what has been so far, or revisiting that for new commissioners may be helpful. In terms of outcomes, having some sense from commissioners what desired outcomes you might have as a part of looking into this issue would be really helpful for us to understand. And it may have been articulated previously, Lindsay and Christine and JH, but really helpful for us to know, is there a problem that we're trying to solve for, or, are there some specific outcomes that you have in mind, for approaching this issue? And then the last, part of this, and then would love to hear other thoughts from you, is, we talked about, Lindsay, you talked earlier, and others who have reviewed the AMPS documents, that what was really helpful is to look at that racial equity instrument, which is something that we are, continually trying to utilize as city staff and more and more and in everything that we do. And we also have a kind of rapid response equity assessment that's a called down version of that really is just a couple of key questions, and they are: who would benefit from a change, a policy, a project, a change of some sort, and who might be burdened, or what unintended consequences there might be. And you just mentioned that kind of in your intro, and Lindsay kind of setting the context for that. And those are good questions for every discussion like this. If we're thinking about changing something, it's usually because we already know or believe that someone might benefit from that. But what else? And really kind of digging deep into those questions as a group, with as many inputs from diverse community members as possible. So that's just kind of a way, one, again, additional way to kind of think about this and to get some input from you all. As staff, as you know, we have so many different kinds of programs, from investments to, planning, things that are happening within Housing and Human Services, broad, kind of cross department, citywide programs services we provide, and investments that we make in homelessness. And so it can be a large scope that could involve a lot of people, or it could be a focused conversation. We want to be able to do, to help the HRC follow through on issues that you're really interested and concerned about, and also just help to provide whatever guidance we can to just have a really productive and focused conversation. So I'll stop there and just see how this lands, and if there are any specific other issues that or next steps that you'd like for us to consider or take on.
We're reaching that point of the night. I mean, I can speak for myself. I'm reaching the point of the night where my thinking is becoming like less clear, and I'm becoming less articulate, and I'm becoming less able to facilitate the meeting. And I'm also hearing the Spanish interpretation.
I think we're hearing Spanish in the English channel. Thanks.
Apparently my capacity is diminishing as well.
No worries.
Thank you.
Sorry, go
No
ahead,
worries. I have some thoughts on those specific prompts that were asked, but I wonder if it's the best time to get into those, that full discussion tonight. I would, but if we're going to move it to like a future meeting, I'd like a couple things with the agenda item, and one that's to like move it to the beginning of the agenda. So we don't find ourselves like repeatedly in this problem where this issue is getting our depleted attention. And then I'm wondering if it makes sense to share some, really there's just the thing that Commissioner Fiegel Art shared with us was an article. So maybe I could share that article to include in the packet, so that commissioners who are brand new maybe, or who just like haven't thought much about this issue for some months now, could refamiliarize themselves with the initial, like what started the conversation. And then a third thing is considering if we, since we're going to be on the topic anyway, if we wanted to invite some guests to talk more about it. So a staff member, and then potentially the group I was ultimately directed to was someone from the ACLU. So that's what who I would consider inviting if we were going to give the item like the full attention. I think it deserves, so we consider all of those things on the slide. And Christine, did you have something?
I was trying to do a thumbs up, but I don't think I can do that in this webinar format. So thumbs up, I support that.
Thank you. Thumbs up from Carlos and Victor.
The one thing I will share, and you might remember, I think I shared this with you earlier, Lindsay, but like months ago, and I'll have to check with our city attorney's office just because there is an active litigation that involves the ACLU and other community members on homelessness. We may be constrained as to whether or not we would be able to engage with it. I don't know that that's the case, but I absolutely would need to check on that. But I think in terms of just like who do you collectively want to have as a part of that conversation? There may be other, individuals again that have, kind of perspective either from the staff perspective or again like former staff, other people that have kind of regional or national perspective on this that might just be good people to talk to really just kind of work through the questions that you may have. And so I think we can certainly help do that, whether it involves, a specific organization or not.
Yeah, I would just be interested in, I don't even know whether this has been done in other municipalities before or not. But to the extent that we don't have to reinvent the wheel with the discussion, I would be really just interested in hearing somebody who's really thought through the implications.
I can share that article. From what I remember, there were some municipalities considering a similar. That's why it came up in conversation. There were some municipalities considering a similar move, and I think still in the considering phase. But I can easily find that in my old emails and share it with Ingrid and Elizabeth for the packet, so everybody can have access to that.
And maybe to help things move along, and I totally agree just generally that we can and should, adjust the agenda however we need to make sure something's got to be last. But I think we can be really flexible to just figure out what topics will get people, to not continue to have this problem. But we could, again, maybe just set up our meeting with Lindsay and with Carlos to talk about the agenda for November. And if this is one of the things that that you might want to talk about, then really kind of put together some options for those people to help kind of share their perspectives with the commission. If that sounds good. And if anybody else has specific suggestions in the meantime, feel free. And I can certainly check in on the issue if there is one with the ACLU presenting at a time when there's an active litigation.
Thank you, Elizabeth. Okay, so then I think I got thumbs up. I was just I didn't see your thumbs up, JH, or hear verbal from you. Do you feel good moving forward with those things I proposed, putting it on the next agenda item, but ideally like earlier on in the meeting, checking in with potential attendees pending the thing that Elizabeth mentioned that we may not be able to invite the ACLU, and then sharing the letter that Commissioner Fiegel initially shared. Does that all sound good?
Okay.
Okay. Well, it's just a thumbs up. So let's just move forward. Let's just move forward that way. Even though I didn't see that affirmative. Yeah, I think we might be having some technical difficulties. That brings us to Roman numeral 8, which is updates from commissioners. First, with event updates. What events did you all make it to? And then also opening that up to staff too, if you feel so inclined. I went to, oh, Carlos, I'm gonna hand it to you first.
Bueno, al principal
Well,
evento que asistí.
The first event I went to was last week in Breckenridge. I was at a housing conference, and my point, what I discussed was how I came out of the community and became a community leader and got to the point where I am today, even being a commissioner on the Human Rights Commission. That's what I spoke about. And I was representing on my powerful community, and I was invited by the city of Boulder. I wanted to share that. It was one of the most important events I went to this month.
Thanks so much, Carlos. Sounds lovely.
Having seen Carlos speak in the forum, I can just share that people really heard and appreciated what he shared. There was another woman on the panel who also was very instrumental in organizing her mobile home community to get what they needed in terms of safe and affordable housing. And Carlos and I thought their stories and experiences in some cases were very similar, but Carlos really, again, just talked about the leadership opportunities that this has created for him, and it was very impacting. Thank you, Carlos.
Elizabeth. I attended some of the Indigenous Peoples Day events. I really enjoyed a dance. I wish I could remember the name right now of the group who's the dance collective that I watched, or the dairy, but I really enjoyed that. In the interest of time, if there are no other event updates from commissioners, we'll make space for other items. Remember, other items, an ambiguous item. It's if something came up during the meeting that feels very urgent, but we didn't get a chance to address it during the meeting. And then follow-up items. This is where staff shares their action items with the level of specificity they choose.
So I think last thing first, we'll plan on connecting with Carlos and Lindsay to talk a little bit more about the protected classes, a discussion and who else to involve there. We'll check in on making sure we have the right process for getting your letter on election timing over to the city council members. So I'll probably be emailing with Lindsay and Christine, probably first-ish thing tomorrow, to make sure we're enabling that happen within our guidelines. We'll take in any comments that you all have by email about the ramps proposal, hopefully to get it over to our colleagues at city staff so they can include any comments in their final memo to city council. There are several milestones coming up in the next several city council meetings in November and December, including on the alternative response program that Wendy discussed. And so we'll again do whatever might be useful to you to help connecting questions or comments that you have for Wendy, and certainly can plan to invite her back to another HRC meeting after the council presentation. And let's see, then we've got some other potential issues for future meetings based on your interest. It could be something input on guaranteed income project. Several of you were really interested in hearing more about that. Potentially other issues like budget, other projects that are happening now, or critical issues you'll want to know about. Last, we have a lot to do to get some recommendations to you for the November meeting on the funding program change. I think that's got it. Ingrid, anything else on our deck?
The only missing item is dates for November and December HRC meeting to be determined. And let me review here. I think that's all I have.
Thank you, Elizabeth, and thank you, Ingrid. One quick clarifying question. Wendy said that she wanted that input for the alternative response program by November 4th. Am I remembering that right?
Correct.
That
Well,
sounds right.
go ahead.
I think that's right. So she can have it to prepare the memo to city council.
And then Ingrid, did you have anything? Just agreement?
No, that is correct. November, November 4th.
Thank you. And then follow up on, is it amps or ramps? I've been saying ramps.
In the memo, it is ramps.
Okay.
I've just closed that document, but I think it's ramps. Yes.
Well, anyway, it's this Thursday, or by this Thursday. So just to highlight those deadlines, and thank you all. Thank you all so much for your attendance and your participation, and for your contribution to run the meeting and do the work. Thanks to commissioners and staff and interpreters and attendees and guests. We hope you have a lovely rest of your night. Thanks for being here.
Good night. Thanks, everybody. Appreciate you.
Can I get a motion, please?
Oh, so sorry. Thank you, Ingrid, for reminding me of the process point to adjourn the meeting. Can we get a motion?
I move that we adjourn tonight's meeting.
Thank you.
Yo la secundo.
I second it.
And everybody says,
Thank you.
right, the ayes
Good
have
night.
it unanimously. Good night, everybody.
Bye.
Good night.
Good night. Thank you.
Thank you.
Buenas noches a
Thank you.
todos.
Good night.
Gracias.
Good night, everybody.
Thank you.
Thank you.